Dear students, welcome back. In the previous session we have discussed about the weight distribution, and now in this session we are going to discuss about the muscles of the ankle and foot. Okay, here in this muscles of ankle and foot, it also includes extrinsic musculature as well as intrinsic musculature. Okay, and here there are no muscles in the ankle or foot that cross and act on only one joint. Okay, all act on at least two joints or joint complexes. Muscle activity will produce joint actions that are dependent on the angle of pull of muscles in relation to the joint axis. In the foot, a joint may be intersected by two axes, and the instantaneous axis of rotation may vary considerably between extremes of joint range. So, what are the things which are affecting the joint range here is, in the foot, a joint may be intersected by two axes, and the instantaneous axis of rotation may vary considerably between extremes of joint range. Muscle action is further complicated by the interdependent nature of the ankle-foot joints. Okay. Now, here there are different muscle locations or mentioned in this pic, and also the axes, how all these muscles based upon its location in relation to the axis, their function of these muscles are going to change. Now we will see. So here how many axes are there? Here we can see the subtalar joint axis and talocrural joint axis, that is the ankle joint axis. So here the circular ones are indicating the muscle attachments here. Okay, so muscles that insert anterior to the ankle joint axis, that is talocrural joint axis. So these muscles helps in dorsiflexion. So the muscles above this axis, in front of this axis, are helpful in dorsiflexion. Here we can see the main, what are the muscles here means anterior to this: tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis. So these muscles helps in dorsiflexion, and the muscles which are inserted posterior to this joint axis, that is which helps in plantar flexion. So what are the muscles we can see here? So triceps surae, and then tibialis posterior, flexor digitorum hallucis, longus, and digitorum longus, flexor digitorum longus, peroneus brevis, and longus. All these have some function in the plantar flexion. Out of this maximum posterior location muscle will have the plantar flexion, and the remaining becomes the accessory muscles which helps in plantar flexion. That we are going to discuss. Okay, and this is about for dorsiflexion and plantar flexion. And the muscles, okay, the muscles which are located, okay, which are located medial to the subtalar joint axis, medial to the subtalar joint axis, causes supination torques. These muscles will produce supination torques, and the muscles which are present lateral to subtalar joint axis produces pronation torques. So what are the muscles which are present medial to this axis? which includes extensor hallucis longus, tibialis anterior, and also we can see this muscles tibialis posterior. All this comes on the medial side. If you see on the pronation, what are the muscles? So extensor digitorum, peroneus tertius, brevis and longus. So these muscles will produce pronation torques and these muscles will produce supination torques. Okay, and the muscles which are present anterior to the ankle joint axis will produce dorsiflexion torques, and the muscles which are present behind or posterior to the talocrural joint axis will produce plantar flexion torques. Okay, yes. Now we will see plantar flexors. What are the plantar flexors? We have seen in the previous thing the muscles which are lying posterior to the ankle joint axis, isn't it? So the gastrocnemius muscles, okay, which arise from two heads of origin on the condyle of the femur and inserts via the Achilles tendon, that is calcaneal tendon, into the most posterior part of the calcaneum. Okay, yes. Now the soleus muscle, which is a deep muscle present to the gastrocnemius, originating on the tibia and fibula and inserting with the gastrocnemius into the posterior calcaneus. The two heads of gastrocnemius and the soleus muscles together are known as triceps surae. Okay, these are the triceps surae muscle and are the main plantar flexors of the ankle. These are the main or major muscles which helps in plantar flexion at the ankle. The Achilles tendon occupies a position on the calcaneum which is far away from the ankle joint axis. That means it is having a large momentum for plantar flexion. So here you can see, so this is the joint axis and this is the muscle are located. So if you see, this becomes the larger momentum because of the muscle insertion is far away from the joint axis here. So which creates larger momentum and helps in the plantar flexion. And this Achilles tendon also crosses the talocalcaneo-navicular joint and therefore acts on it also. The resultant combined action line of the gastrocnemius and soleus muscles, which are passing medial to the axis of the subtalar and talocalcaneal joints, so that the activity of the gastrocnemius and soleus each produce strong hindfoot supination also. This one also produces supination. Okay, so activity of gastrocnemius and soleus on the weight bearing will lock the foot into a rigid lever both through the direct supination of the talocalcaneo-navicular and through indirect supination of transverse dorsal joint. So those things you people have already know it. Okay, so continued plantar flexion force will raise the heel, okay, and causes elevation of the arch. Okay, the elevation of the arch by the triceps surae is easily observable in most people when they actively plantar flex the weight bearing foot. Elevation of the arch occurs through the twisting of the osteoligamentous plate, that it is a model. Okay, we have already seen, as the hind foot is inverted, and through tightening of the plantar aponeurosis with MTP joint extension. Here we can see there is a combination of axis during plantar flexion. Now we are observing with the action of gastrocnemius and soleus muscle, isn't it? So it is working on different joints and causing different actions at different joints and helps in the ankle plantar flexion. That means during weight bearing it helps in heel raise. Okay, so at the other ankle plantar flexor muscles, or the plantaris and the tibialis posterior, the flexor hallucis longus, the flexor digitorum longus, and the peroneus longus and brevis muscles. So all these muscles, we have seen that, so all these muscles are located posterior to this axis. So these will have some function which helps in plantar flexion along with gastrocnemius and soleus muscle. Okay, out of these muscles, the plantaris muscle is so weak that its function can be disregarded here. The tibialis posterior muscle is predominantly a supinator of the foot, and it is having large momentum for both talocalcaneonavicular and transverse tarsal joint. So if you can see here, tibialis posterior here, and if you see for this joint axis, which is very far away from this axis and which helps in the supination. Okay, that we can call it as powerful supinator here. Okay, yes, and it is also acting at the transverse tarsal joint also, and its relatively small cross-sectional area enables it to produce only half the supination torque of the soleus muscle. Okay, the tibialis posterior plays a significant role in controlling and reversing the pronation of foot that occurs during gait. Okay, so that is the major function of this tibialis posterior. Now we will see flexor digitorum longus and flexor hallucis longus now. Yes, here are the muscles we can see here. The flexor hallucis longus, here the tendon, and the flexor digitorum longus we can see here. So flexor hallucis will is present behind the hallux, that is the first tarsal. Okay, and then flexor digitorum we can find below the second digit here we can see. So these muscles both span the medial longitudinal arch and helps in supporting the arch during gait. So the arches are maintained by these two muscles. Okay, these muscles attaches to the distal phalanges of each digit and through their actions causes the toes to flex. Okay, and flexion of the interphalangeal of the hallux by the flexor hallucis longus muscle produces a press of the toe against the ground. Okay, flexion of digital and proximal interphalangeal joints of the lesser four toes, okay, by flexor digitorum longus causes a gripping action. So this digitorum longus helps in the gripping action that may produce by clawing of metatarsophalangeal, that is MTP extension and IP flexion. MTP extension and IP flexion. So this gripping activity or gripping action is done by these fingers. Okay, and similar type of action we can see in the fingers when the proximal phalanx is not stabilized by intrinsic musculature. Okay, so and we will see the other muscle actions, that is peroneus longus and brevis muscles. Okay, so these are the primary pronators of the foot, the peroneus longus and brevis muscles, which are primary pronators of the foot. So as we have seen that these muscles are inserted on the lateral aspect of the subtalar joint axis, which helps in the pronation, isn't it? Yes. So although the moment arm for subtalar pronation is small, the peroneus longus will plantar flex and pronate the first ray to which they are attached. So because of its peroneus longus tendon attachment, it helps in the plantar flexion as well as the pronation of the first ray to which it is attached. Okay, this action facilitates transfer of weight from lateral to medial side, okay, of the foot, and stabilizes the first ray as the ground reaction force attempt to dorsiflex it. Okay, the peroneus longus muscle is also credited with support of transverse and lateral longitudinal arches. So because of its attachments, so it is supporting the transverse arches, okay, transverse arches as well as the longitudinal arch. Okay, so these are the muscles which helps in different actions of the ankle joint. Okay, so and the muscle appears to be contradictory to its function as pronator of the foot. So it appears to be a contradictory to its function as a pronator of foot, but the tendon of the peroneus longus spans the tarsals transversely and passes under the cuboid bone also, thus helping to limit its depression. Okay, so these are all the functions of the muscles which helps in plantar flexion as well as supination and pronation. If you see the dorsiflexors, so what are the main muscles which help in the dorsiflexors are the tibialis anterior muscle and the extensor hallucis longus and extensor digitorum longus and peroneus tertius muscles. So the tibialis anteriors and extensor hallucis longus are considered to be the strong dorsiflexors of the ankle and may also weakly supinate the talocalcaneonavicular joint. So these two muscles are the only supinators active when the heel first contacts the ground in gait. A period when there is a strong pronation force and a strong pronation force on the hind foot. So when there is a strong pronation force on the hind foot, these two muscles, though these two muscles are very strong dorsiflexors, they will act as active supinators when there is a strong pronation force on the hind foot. Okay. And the tibialis anterior can exert only slightly more than half the supination force of the tibialis posterior. Okay. And the extensor hallucis longus is a weak supinator than the tibialis anterior itself. Okay. So tibialis posterior also a supinator, but anterior will have half of the function of tibialis posterior, and this extensor hallucis longus is still weaker than the tibialis anterior in supination. Okay. The supination action of the tibialis anterior muscle may reverse if the line of pull falls to the lateral side of the subtalar joint axis, as it may lead to excessive foot pronation. Okay, so here it is limiting the excessive foot pronation here. Okay, the extensor hallucis longus also extends the MTP joints of the hallux. So this one extends the MCP joint of the hallux. This is the MCP joint of the hallux. Okay. When the extensor hallucis longus attempt to dorsiflex the foot without the assistance of the tibialis anterior, the first toe will tend to claw. The first toe will tend to claw without tibialis anterior assistance. Okay. So why? Because here it is going to more extension than the normal degree, which causes flexion at the interphalangeal joints. Okay, the extensor digitorum longus and the peroneus tertius muscles are relatively weak dorsiflexors. Extensor digitorum longus and peroneus tertius are weak dorsiflexors of the ankle and the pronators of the foot. The extensor digitorum longus also helps in extension of the MTP joints of lesser toes. Okay, and this is the main functions of these muscles. Okay, yes, so these are all about the extrinsic muscles of the ankle and foot. In the next session, we are going to discuss about deviations from normal functional structure, which includes flat foot, that is pes planus and pes cavus. Thank you.